Good afternoon. We're here with Humboldt County Health Officer Dr. Teresa Frankovich. Thank you for being here with us.
Thank you.
There have been some anecdotal reports of Redwood Acres testing site losing tests and thereby not having results for those tested, as well as delays as long as nearly 2 weeks on getting test results. Is that something that you are aware of, and how is it being addressed at the county level?
So, the Optum site that we have at Redwood Acres was initially an enormous gift for the county, and it still is it's a good resource for us. But at the outset, we were one of a small, actually, we were the first county to begin using the Optum site. And what's happened is testing has expanded across the state, and vastly more people are being tested. These sites, such as Optum and Verily, that send their specimens to large commercial labs, are finding that those labs are getting backed up. And so it's causing a delay in processing specimens and reporting specimens, which is hugely problematic. No one wants to find out 6 days after they have been tested that they're positive, both the individual and for contact investigation purposes. We need to have speedier test results. What I've been hearing recently is that turnarounds has been as long as 6 to 8 days in general, and we need it much quicker than that. So we are very actively at the county level investigating other opportunities for testing that we may be able to utilize and have some better turnaround times in the system.
Thank you. And to tap onto that first question, this reporter says, also, are there any similar problems being seen at other local testing sites, for example, Garberville or Willow Creek?
When we're talking about Garberville, that was our Optum test site from Redwood Acres. We were, although it is not designed to be a mobile test site by Optum, we pleaded with them to be able to take the setup off-site so that we could get to some areas that are underserved. And we are able to continue doing that, although we're somewhat limited in how often we are able to. In Willow Creek, that is a Verily, which is sort of just another entity like Optum that was doing that through Trinity County. That site actually has been challenged by low turnout. And so Trinity is no longer going to come on a regular basis to Willow Creek, but said that they would be able to come and help us out if there was an increased need in that area. To the previous question about losing tests, that is not, as we understand it, an issue of the local company losing the tests. It's an issue of the tests getting sort of lost at the lab, at the referral lab. Sometimes it's not really a question of being lost, but specimens may just not be able to be tested for various reasons or have indeterminate results and not satisfactory, and so they have to be redone to have an accurate result.
Thank you. And here's one more test question. At the Redwood Acres site, residents are seeing long wait times to get an appointment, long turnaround times for results, and even instances of being asked to get retested. How confident is public health that our case count of both positive and negative cases is accurate? Also, how can public health and the community understand how widely the virus is circulating if there are these issues with testing?
So good questions. In terms of the case counts, the issue really is one of delay. So ultimately, these tests that have long turnaround times, we do get the results, but it takes much longer. So on a day-to-day basis, we're not able to report as accurately about results for that reason. In terms of the accuracy of those tests, I have confidence in the accuracy. The actual number of tests that are not able to be run or have problems are actually relatively small. The real issue is the delay. So once we have the results, we feel confident in them. In terms of how widely it's circulating, frankly, the lag time for this testing being about a week to sometimes slightly longer means that our numbers are delayed. But ultimately, from a surveillance standpoint, we're able to see trends over time. I think what's a more important issue is the one we discussed, which is that the turnaround time being long makes it less useful for contact investigation, being able to promptly isolate and quarantine people.
Mendocino and Lake counties both are very rural, like Humboldt, Each has fewer total cases than we do, as well as smaller populations, and yet they release current hospitalization data. Could you please provide that information or explain why you feel our situation is different than theirs?
Well, I think, we've talked about this before. Public health historically has had great sensitivity to concerns about revealing people's identities and basically publicly stating their confidential health information. I think most of us appreciate the fact that that's a good idea. That we don't want our personal health information discernible to our neighbors. And so in small communities, if your neighbor gets hospitalized and then you hear there's a new hospitalized COVID patient, sometimes that's enough to make you go, I think that's what's going on here, that type of thing. And so for that reason, historically, again, public health has not put out small numbers at a time. However, COVID seems to be a different environment, and information that normally would not have been given out in this fashion is, and it's actually now becoming available at the state level. And what we'd like to do actually is there is a state site that reports on sort of the daily hospitalizations. So we'll make that site available to the public, provide that link so that you can see that information if you're interested. It may not be exactly accurate on a day-to-day basis, but it will give people a general idea about hospitalizations.
Thank you. When doing local contact tracing, can the health department ask people whether or not they have gone to a recent protest?
We can ask about everything, and we typically do. What we're looking at is where have you been and what have you done in the 48 to 72 hours before you developed symptoms or before you had your test date that was positive. And so anything that you've been doing in terms of gatherings and contacts with other individuals is relevant and important. So yes, that is information that we do ask in the context of our larger investigation.
Thank you. Before the 4th of July, the governor said any public or private events this weekend that include people who do not live together in the same household should not happen. This includes family get-togethers. What message do you have for the people who ignored that suggestion over the holiday weekend locally?
Well, it's probably no secret that I've been frustrated by this. And I think, I completely understand the desire to socialize and have a bit of normal life as we had known it. The problem is that I can tell you absolutely that as we're dealing with new cases coming in and calls even that were over the weekend here, that there are people who are becoming ill or exposed in settings like birthday parties, visiting family, either our residents going elsewhere to visit family and coming back exposed, or exposed family members coming here and exposing the household. And so there is no doubt in my mind that a lot of what is driving our increases going forward is gatherings. And as much as I hate to say it, we really, really need people to be able to limit those gatherings outside their household unit. And it won't be forever, but it's important now. Again, the real issue is not trying to make our cases zero. We need to control our number of cases so that, again, people have access to the health care they need when they need it. And, as we've pointed out before, in pandemics or epidemics of this sort, people die not only because of the direct effect of the virus on their body, but sometimes they die because they can't get care that they need at the level they need for the infection, or they die of heart attacks, car accident injuries, strokes, because they can't get the care they need when the hospital is full of COVID patients or the ICUs are full of COVID patients. So it's really an investment in each other to just really be cautious at this point, knowing that when we can do it more safely, we'll open up more.
With more and more places reopening and people out and about more, how do you feel residents have been doing overall when it comes to masking and social distancing? Do you think residents acted responsibly this 4th of July weekend?
Well, I hope that a lot of people did. And when I go out and about and see people masked in the grocery stores and different places around the community, I find that encouraging. And, I feel proud of the community. because, you know, it's something, again, that isn't really meant to protect you. It's meant to protect everybody around you. So, I think that compassion for our neighbors and friends is really important. I think that a lot of people restricted what they would normally be doing on these holiday weekends, and I appreciate that. Although I can also certainly say that, we're probably all aware of people who were gathering with extended family and having parties. I do want to remind people that while, large gatherings, 100, 200 or more people, increase the risk to the community dramatically. And when I hear of weddings and things like that being planned that involve hundreds of people, all I can say is no one has the capacity here to do contact tracing, investigations, and that for hundreds of people at one time. It is just not a feasible thing to do. And so I want to tell people that while large gatherings are particularly problematic and worrisome to the community, what we're seeing right now are a lot of smaller gatherings. It's 10 to 20 people at birthday parties, barbecues, things like that. Each of those generating additional cases and quarantine people who are exposed. So again, we just really need to limit these activities right now. It should be your household unit and you outdoors and doing all the things we love, just not with other families right now.
Great, thank you.
Thank you.